For this week's speech, we are required to have 2 people in our audience. This week I'm doing my speech on test tube babies. Test tube babies is a slang term for in vitro fertilization. In vitro fertilization is something that many people are not familiar with, much less knows how it works. In vitro fertilization is the solution to a problem that many couples come across these days. In vitro fertilization is a procedure involving fertilizing the egg with sperm outside of the mother's womb in a lab dish, and then it's placed back into the mother's uterus. Natural conception is a process. Natural conception is a normal pregnancy where the male sperm penetrates the woman's egg in the natural way. Some women are unable to get pregnant through the natural conception, and they have to try fertility treatments. And then many times the fertility treatments do not work, and they have to look into the more expensive, time-consuming in vitro fertilization. In vitro fertilization has contributed to nearly 5 million births. In vitro fertilization has been around since the late 1970s. In July of 1978, the first test tube baby was born, Louise Brown. Robert Edwards and Patrick Steptoe were both a part of the process, and then in 2010, Robert was awarded the 2010 Nobel Prize for Physiology and Medicine. In vitro fertilization is a long process, and it's many steps to the process. The process varies based on the clinic, but it's all pretty much follows the same basic steps. Step 1 is suppressing the natural menstrual cycle. And what that is the woman is given a daily medicine for 2 weeks to suppress her natural menstrual cycle. Step 2 is superovulation. Fertility drugs containing FSH is given to the woman. It makes the woman produce more eggs than normal, and then they do ultrasounds to monitor the process of the ovaries. Step 3 is receiving the egg. The egg is collected through a minor surgical procedure. Where they stick a needle in through the vagina. It's a very tiny needle. It's hooked up to something. It's hooked up to a suction. It's hooked up to a suction thing where when they get into the ovaries, it pulls the eggs out. They try to get about 15 eggs with each time, so they have a better rate of success. Step 4 is insemination and fertilization. The eggs that have been collected are placed with male sperm and kept in an environmentally controlled chamber for a few hours. After a few hours, the sperm will eventually enter into the eggs, or sometimes the sperm is directly injected to the egg. A problem that many people wonder is frozen sperm just as good as fresh. They're both the same. The fertilized once it's injected in forcefully or does it on its own, the egg then starts to divide and become an embryo. The doctors usually try to implant 1 or 2 back into the mother. Step 5 is embryo transferring, and that depends on how many they implant. Depends on what the doctor and the couple discusses. It's done. The transferring is done through a calf-like insertion back into the womb. The embryos stick to the womb and grow as they would in a healthy pregnancy. Women who are not able to have their babies, to carry a baby through natural conception, they have to go through like 12 different things of the fertilization treatments and stuff before they are allowed to try in vitro fertilization. There's many side effects to it, along just like it is with a natural pregnancy: nausea, vomiting, difficulty sleeping, abdominal pain, enlarged ovaries, and hot flashes. The major cause of pregnancy losses with in vitro fertilization is the chromosome imbalancing with in vitro fertilization. Even though it seems like it's such a simple solution, it is very expensive and very time consuming, and couples may have to try multiple times in order to be successful.